my name is Christine Rayfield, and this is my return demonstration for NR224 wound care skill. I'm providing privacy for my patient already, so as I enter the room, I'll close the door behind me. Shut door. Good afternoon, Bobby. How are you doing? Good. My name is Christine. I'll be your nurse today. First thing I would like to start off with is I'm going to take a look at your armband. Can you just verify your name and your date of birth? Okay, wonderful, thank you. So what I'm here to do is to change your dressing for your wound. What I'll do is take off the old dressing, assess the wound, make sure it's healing right the way it should, and then I'm going to put a new dressing on top of it. It should only take about 10 minutes. Do you have any questions before I get started? And do I have your verbal consent to do that? Okay, wonderful. So I'd like to assess your pain level first on a scale from 0 to 10. Can you tell me what your pain is? 0. Okay, good. So that means that we don't need any pain medication. And do you have any allergies? All right, wonderful. So my supplies are already on the table, and I made sure to clean them before I put them onto the table. And I'm going to perform hand hygiene and don clean gloves. I'm going to place this absorbent pad underneath your arm. Okay, I'm going to take off this dressing and remove the packing. So looking at the wound, it is red and it is odorless. There's no odor to it. The consistency looks like a serous, a clear, wet consistency, and there's not a lot of it, so it's very minimal. Everything looks like it's healing good in the way it should be at this point. I'm going to discard of this. If it's saturated in blood or bodily fluid, I'll put it in bio. Put that over here. And I'm going to take my sterile cotton tip applicator, and I'm going to use this to measure the length or the depth and then tunneling. So I'm not seeing any tunneling. I also don't see any eschar, any necrotic tissue. I'm going to place this cotton tip applicator at the deepest part of the wound and lower my hand until I reach the skin. I'm going to measure that. So the depth is 1 centimeter. And I'm going to dispose of that cotton tip applicator, and I'm going to measure the length. And 11 centimeters for the length, 2.5 centimeters for the width. And then I'm going to dispose of that measuring tool and then also doff my gloves and discard of them. I'm going to perform hand hygiene again. And I'm going to open my sterile dressing change tray. I'm going to get the barrier out and only touch it onto the border so that it remains sterile. Place that down. I'm going to don my sterile gloves. Discard of this. I'm going to make sure that I keep my hands above my level of the waist, and I'm also going to make sure that the table or the bed is up to my waist level as well, which it already was. I'm going to remove my scissors and dry gauze, ABD dressing, sterile cotton tip applicator, tape, dressing, packing gauze, and then I'm going to open this sterile saline and then put it into the container and then set that aside. And then I'm going to take a 35 milliliter or a 60 milliliter syringe and draw up some sterile solution. So I have my syringe, and I'm going to take a dry piece of gauze, and I'm going to irrigate the wound from the top to the bottom, and I'm going to do that until the drainage is clear. So I'm irrigating, and I'm catching any drainage and debris with my gauze down here at the bottom. And then I'm going to discard of my syringe and that gauze. And then I'm going to pat that dry with the dry gauze. And I'm only going to use it once before I discard it. Okay, so it's dry. Now I'm going to get some packing gauze. And I'm going to moisten this in the sterile saline as well as my cotton tip applicator. I'm going to pack that into the wound. I wouldn't use my finger, but I'm just going to use it now because it's not really wet. Okay, so it's packed. I'm going to discard of this cotton tip applicator, place 2 pieces of dry gauze on top of that moist packing, and then put my ABD dressing on top of that. I would use my tape, and I would tape the 4 corners, half onto the dressing and half onto the skin. And I would label the dressing with my initials, the time, and the date. And discard of all of my supplies. Into the proper trash receptacle. Remove my gloves. Discard of those. Hand hygiene. Okay, Bobby, you said your pain was a 0 earlier. Is it still a 0 right now? Okay, wonderful. I'm going to lift up the side rails on the side of the bed, perform hand hygiene again, and then make sure that the bed is lowered to the lowest level and that the wheels are locked. Make sure that the call light is within reach, and thank my patient. Thank you, Bobby. If you need anything, just press your call light and I will come back to check on you. Thank you. And perform hand hygiene again as I exit the door.